So the good thing is that we have already evidence nowadays that AI can assist us. And this may be a little bit surprising to many, that if you do this in a randomized controlled trial, that in fact these techniques already help. And this is on top of obviously bowel prep and the way you do your colonoscopy. So this is a large RCT with 700 patients from Alessandro Ripeci, a multi-center trial with multiple endoscopies. And you can see that all over there's an increased adenoma detection rate, and this applies to all sizes of polyps, and both on the left and the right side of the colon. So there's an overall increase when CAT-E, so the detection aid, is applied. Also, when you do this in a back-to-back study, in a Chinese study here from Wuhan, there are not only bad things coming from there, also very nice studies on AI. You can see that there's a significant reduction in the miss rate of polyps. So this is what we usually do in these studies. You go in once and you go in the second time and see what you missed during your first pass. And then if you see that the CAT-E is used in the second column, where CAT-E is used in the first pass, the miss rate is about 14%, and the other arm it's 40%. So this also means that the system is not flawless, right? What about Barrett's esophagus or the esophagus in general? We had the pleasure to be a part of the August project, where image-based analysis was, or image-based CAT was developed. And you can see that the end result was pretty good. Again, you need to take into consideration that this is the ideal world, the perfectly cleaned Barrett's esophagus, nicely sharply taken pictures, and then the system is really very accurate in finding where the lesion is in about 92%. Meanwhile, we have proceeded and moved forward, where the first promising results have been published on real-time video detection in the field of Barrett's neoplasia. And you can see that the system from Professor Messman has a sensitivity of 83%, and the system from Professor Bendari, 96.3%. But obviously, again, you can see this is all very clean. And you may argue that anybody can see these lesions, and you would agree if you know there is. But if you go back to that study from Amsterdam that I showed you before, these are the lesions that are actually missed in 30% of the cases. So I think there's a really need for assistance here. So everything in the end will still depend on humans, and we need to stay in control of the system, that's for sure. So the questions to be answered, is there going to be overdependence on the system? Is there a risk of descaling? Do we really know what's going on in that black spot that generates the output? So we need to realize that the convolutional networks are not humans. They look a little bit like that, and they develop themselves, but the black box itself is something we cannot look into. So and the main issue here is to realize as physicians, if we're going to use this, that the system cannot do what it is not trained for. So we should know what it can do and don't suppose what it could or should do, because it's not a human being.
And then you suddenly zoom in on it, and it's clear, just embarrassingly clearly an adenoma, right, when you go up to it, and then you can characterize it and then see it further. So, yeah, I mean, I think that, you can make the point that that is, I mean, do you see that as the role, Raf, or you see it differently?
No, absolutely. I think that's how it works. And the fact that you sometimes as false positive isn't, I think, a negative part of this, or negative aspect of these techniques. On the contrary, it just focuses you on these areas that you need to focus on, and also maybe by showing these things that you need to look at, then also the system trains you to look automatically, even if it's nothing. And like you say, if you miss something and you have a box, you go back, and then you have a closer look. I only wonder why it should only work in white light mode, right? Because we have these studies that indicate that, especially now with the bright NBI, that it may increase in itself also polyp detection. Certainly there's data on LCI. We've done some preliminary studies with our own system showing that LCI may actually work better with AI. So I think that's also something that needs to be looked at in the future as well.
I mean, everyone likes to be confirmed in what he sees, and it just strengthens you to do the right thing at that time.
But what if it's not right?
Yeah, that's what it's all about. And Raf showed us that, I mean, the data are actually that it outperforms the clinical assessment by the expert right now. So I think we should accept that it's right.
Yeah, I think that we need to realize that's not perfect, right? And if you want to overrule it, you're still free to do so, David. So don't feel obliged
But I
to
mean,
the
this,
system.
but just
But
look
it's
at-
like,
just
yeah.
look at this, right?